Hey, good morning, good afternoon, or good evening, depending upon where on the planet you are. This is Eric Rubenstein. Most of you who are tuning into the various podcasts that I do, Coffee Compliance and Chuckleheads or Retro Fraud, know that I am Advize Health's Director of Fraud, Waste, Abuse, litigation support. We here at Advize are passionate about healthcare in all sides of healthcare. We work for providers, we work for payers, we work with law firms, we work with SIUs and IT services companies, all looking to try to make healthcare better. We try to make sure that payers get paid for what they should do. We try to make sure that the payers are paying what they should. Part of that is also being benevolent and altruistic with the things that we're interested and passionate with. Some of you know Jean Marie Loria, the owner and chief executive officer of Advize. She's very passionate about projects that are important in the healthcare world. One project that she's inordinately passionate about is something called $4. It is a not-for-profit, and their job is to help people who qualify for charity care get that charity care. For those of you in the healthcare space watching this, you know that hospitals are sometimes not the friendliest groups to deal with, particularly when it comes to paying large bills that are out there. Today, I'm taking a few minutes outside of the Coffee Compliance and Chuckleheads and the Retro podcast and some of the other Advize-related stuff to talk to Jared Walker here over Teams. Jared is the founder and CEO of $4. You can find them on DollarFOR.org. They're not-for-profit. We've been connected up with Jared for a while. Jean Marie sits on the board. A lot of people involved with Advize work on committees and do things to help to support $4 and Jared. We bring Jared to conferences with us so that he can meet people that are influencers in the healthcare, fraud, waste, abuse, and compliance world. And his company is really here to help to facilitate getting bills crushed through getting people into charity care. Unlike some organizations that are out there in which they just buy the debt and then pay off that debt at pennies on the dollar, that doesn't really solve the problem. Solving the problem is working to ensure that people who really can't afford to pay these bills but would otherwise qualify for something known as charity care can get that charity care. Jared works very lean in his business. As you can see, he is working in what appears to be the $4 bunker. It is him at the helm with a small group of paid people and a large group of dedicated volunteers. And I wanted to just talk to Jared about what's going on with $4 lately, because they've hit some very big milestones. So Jared, give me that sort of thumbnail sketch of how $4 works. How long have you been going with $4, and where is $4 heading?
Yeah, so we officially launched 2015. So we've been at it. We just celebrated 6 years. And we actually just hit $10 million of medical debt relief, which is crazy. That was actually this week. So what we do, I mean, like you said, we enforce hospitals' charity care policies. We've got millions of people that are declaring bankruptcy or on payment plans for medical bills they don't have to pay. A lot of people have no idea that these programs exist. And even if they do, they can be a nightmare to apply for and access. And then at the same time, you're in the midst of a medical crisis, and filling out all these forms is the last thing on your to-do list. So what we do is we try to take that burden off of people. We fill out the applications, we send it to the hospital, we follow up and hopefully follow through with that patient until the medical bills are gone, or at least significantly reduced. So that's what we do. Every dollar donated, we're able to eliminate about $50 in medical debt for people. And where we headed, we're trying to scale right now. We've got there's no lack of need. So many people need this resource, and we're just trying to spread the word, empower patient advocates. People just have no idea that this is a thing. So we're hoping to crush even more medical bills and scale so we can meet the need that's being presented to us.
So, one of the things that I found interesting in talking to you and doing some research on $4, but also some of the experiences that I had working as a special agent with the U.S. Department of Health and Human Services Office of Inspector General. So I did criminal, civil, administrative cases, and I saw a lot of the way fraud schemes worked and how payments are made and things of that sort. But one thing that I know you and I spoke about, and I've spoken about it with other people, that I find to be amazing is sometimes the path to getting charity care is so difficult that hospitals make it difficult. And the one story that I think sticks out to me is when the hospital says, in order to be reviewed for inclusion in the charity care program, you must fax in documents, and how some of these people are living paycheck to paycheck. Their only way of dealing with getting to the outside world is through a cell phone, in which they have either a limited data plan or they live near a place where there's free Wi-Fi. Or, they just don't have that kind of money. But more importantly is, in today's world, nobody has a fax machine. And so things like people being able to get documents to you electronically and having you cut through a lot of that red tape. And I understand that some of the way that you've been able to do that is through some new applications that you've got, in which you can help people with completing some of the required forms in a simpler process. And I think where people always want to know is, when they donate money to a charity, where is that money going? Now, you said for every dollar you take in, you're reducing or crushing or removing $50 worth of debt, which is really unbelievable, which means that your overhead is fairly low operationally. But I'm assuming that through the use of electronic mediums such as the internet and web-based products and things like that, that's really helping, because now people aren't having, there's no fax machine costs, there's no phone line costs, there's no paper costs, things of that sort. So how are you making it easier for people to get to you, to get these documents to you for vetting?
Yeah, so we've got a web tool that actually went live 6 weeks ago. So we, we had a TikTok video that went crazy, and we had all these people reaching out from all over the country. We really weren't set up for that. And we had about 50 volunteers get together and collect the charity care policy data for every hospital in the country. So we've got a tool now where a patient can go to our website, dollar4.org, click on the See If You Qualify tab, and basically put in their household income, household size, what hospital, how old the bill is. It's like 4 or 5 questions, and it'll tell them this is what you're eligible for according to this hospital's policy. So that's one way. And, hospitals are added to that every day. And, we're continuing to update this database. But the web tools, patient advocates, we have volunteers that are doing this work as well. So, yeah, that's how we're doing it. Hopefully, does that answer your question?
Yeah, it does. And you talked a lot about volunteers and advocates. Are you always looking for more volunteers and more people that you can help to get this process moving? Obviously, it costs money to do this. So part of this is that you need people to donate to operate the business of helping people, right? You still need to be able to pay for the internet and the laptops and developers to do this, but people can help in a lot of different ways. So if someone wants to volunteer, how do they do that?
So you can go to our website, sign up on the volunteer page, and every month we do like a volunteer onboarding call. And then also every month we do like a level 1 patient advocate call as well. So we just last time we did it, we had like 55 people register, and we basically just go through everything that we've learned about charity care, hospital policies, how to find these policies, how to submit the applications. And this is like, people that just want to know the knowledge. We want to empower people and equip people with the tools so that they can do it for themselves. They can do it for their friends, family, neighbors, and they don't necessarily have to formally volunteer hours for $4. This is just like a knowledge download for people. And then if they're really interested and they want to say, hey, I want to take the next step and do this on behalf of $4, then they can hop on another call and we'll do like a more in-depth training.
And what about the most important piece, which is Mr. Green? Mr. Green needs to pull up. Mr. Green needs to pull up to dollar4.org to help this, because I think the people watching this have to understand that when you're getting rid of a bill, crushing a bill, reducing a debt, it's not $4 paying that debt. It's getting the hospital to abide by charity care rules that are out there, but $4 still needs money to operate and work. I know you've got some corporate sponsors, individual sponsors. What are some of the ways that people can donate actual money to make this a productive process?
Yeah, so we rely on one of the biggest ways people can sign up for a recurring monthly donation. This is a huge help to us. We rely on monthly donors. You mentioned corporate sponsors. You can check out our partners page if you want to get involved at that level. But yeah, we need people to donate so we can continue to run these programs. Like you said, we're not paying medical bills. We are enforcing these policies that exist, and we've got a small team. We're scrappy, like you said. I'm in the bunker. I'm in the bunker. But it's we're able to do a lot with the donations we get. So donations are absolutely essential.
That's great. And what is your currently, how much money have you been able to reduce or eliminate?
I am on the screen right now. $10 million, 74,023. That is where we're at. A little over 10 million.
Since inception.
So this is actually just from 2019 when we launched our debt forgiveness program. So it's escalated quickly. And actually that number is outdated because yesterday we had over $200,000 in medical bills waived that we haven't updated. So
right. No, and that's fantastic. And I think that's something where people, like to hear that in today's world where charities often have operating costs that are equal to 50% or more of the total amount that they take in. You see all the time instances of charities where for every dollar that's taken in, 50 cents or 60 cents is to the operation of the organization, when the whole point of a charity is the maximum amount of money that comes in should be used towards the charity. It's important for people to understand that the work that you're doing is not paying a debt or assuming a debt. It's getting that debt removed, which means that the entire overhead of $4's existence is to pay for keeping the lights on and the administrative costs associated with being able to process this. I know from talking to you and from talking to Jean-Marie that for a very long time you weren't taking a paycheck because this was something you have a passion about, and even today you're not taking much of a paycheck because you still feel like a lot of this needs to go back into $4 and operate the way it is. There's a heavy reliance upon your patient advocates and volunteers. All the people on the board are obviously volunteers. People on the committee are volunteers. And as you know, we work at Advize very hard to help with doing fundraiser related things because this is an important piece of the puzzle. There are unfortunately a lot of people who walk out of the hospital with bills and have no idea. I say it all the time. In what other sector of consumerism can you think of in which a person does not have some idea what the cost of that item, product, or service is going to be before they get it? You go to buy a car, and although there's a sticker price and you don't pay above that sticker price, you at least know what your jump off point is for that item, product, or service. You typically don't get something in which at the end someone hands you a bill and you go, oh, that's exactly what I thought it would be. Obviously, there are some things that are coming out through the Office of National Coordinator for HHS. There's a whole thing involving price transparency. And if you're following up with that, it's very, very complicated, very convoluted. And so, I think that's going to help as time goes on because cash pay patients are going to see what rates are. And many of these people wind up being underinsured or cash pay patients. And so there are going to be some ability out there to help with some of that negotiation. So, thanks, Jared. I know we wanted to only make this a quick one, so we're kind of out of time because we kept it short. But for those of you that are watching this or spent the time to look at this past few minutes of this, $4.org, it's an organization that we support at Advize. A lot of other organizations support it. It's an important piece. People should not be dying over debt is really what it comes down to, is people are wondering if they're going to be able to pay their bills to keep food on the table, keep their cell phone on for their job, put gas in the car, things of that sort. There are a lot of organizations that work to facilitate this, but $4's real premise is not buying that debt, which doesn't fix the problem. It's getting rid of the debt, which helps to facilitate and empower people to learn about fixing the problem. So, Jared, thanks a lot. We hope that we hear a lot more from you in the coming months, and that number continues to climb.
Absolutely. Thanks for having me. Thank you.
Yeah.
Appreciate you. Appreciate Advize and all the support.